Host is a broad term for any organism that provides a biological refuge to another organism. All organisms respond to their environment in a number of ways that can be chemically measured or physically observed. So the host response to infection refers to the biological processes that occur in response to a pathogen entering the body and causing disease. Host response to infection is the other side of the coin to pathogen identification. Host response biomarkers can do two things. They can help define the pathogen class that is most likely causing a patient's symptoms, and they can help define the patient's underlying immunological state. So host response diagnostics are significant because results can be used in combination with pathogen identification to more quickly define appropriate care. The medical applications of host response to infection actually go back to ancient Chinese and Egyptian texts, dating back as far as 2700 BCE. They describe various syndromes consistent with malaria, dysentery, and parasites. Across the modern era, advances in chemistry and physics were applied to medicine and provided new insights into what was happening to a patient at the microscopic and the biochemical level, and some hints on how to fix it. For host response diagnostics, that evolved into reliably measuring components of the innate immune response to inform care. Host response diagnostics can support patient assessments in many clinical scenarios. Host immune signatures that differentiate between bacterial and viral infections can improve appropriate antibiotic use. For example, MeMed-BV measures the concentrations of 3 host immune proteins to derive the MeMed-BV score, which helps differentiate bacterial from viral infection. Real-world evidence suggests, when properly implemented, the MeMed-BV test reduces inappropriate antibiotic use by 25%. Another example is using white blood cell morphology to evaluate sepsis risk. Monocytes are known to change in size and shape in the presence of pathogens. Monocyte distribution width, or MDW, measures this heterogeneity and reports a value as part of the CBC with differential. Abnormal MDW values help identify sepsis, even if the signs and symptoms aren't obvious. MDW values have been associated with reduced time to antibiotic orders in real-world settings. There is limited clinical utility in any single biomarker. So rather than measuring many host response biomarkers individually, the future will leverage complementary information from multiple markers. With those results, we can identify a pathogen class or evaluate the nuances of an individual's immune response. Collectively, this information helps physicians make better judgments about which interventions to try next to achieve the best possible outcomes for the patient.